Good evening to the listening and viewing public, and we thank you for joining us for this press briefing as we keep you updated on the COVID-19 situation here in Dominica. A special good evening to the Minister for Health, Wellness and New Health Investment, Dr. Irvin McIntyre, to the Permanent Secretary, Leticia Lestrade-Wyke, the National Epidemiologist, Dr. Shaluddin Ahmed, to the Principal Nursing Officer Acting, Terelia Ravalier, Deputy Police Chief Lincoln Corbett, to the media. Good evening once again. This evening we'll have presentations by the National Epidemiologist, the Principal Nursing Officer, and also the Deputy Police Chief. As always, we urge you to pay very close attention as the credible details and information are being presented to you. We'll begin this evening with a situation update from the National Epidemiologist, Dr. Shaluddin Ahmed.
Thank you, Ms. Harris. Good evening, listener. We have another confirmed case of COVID-19 virus. The case is 70-year-old from another locality, and this case has been hospitalized. As of today, we have a total of 12 confirmed cases of COVID-19 virus. All these cases are at this time stable, clinically stable, and some are asymptomatic. There is no death so far. So far, we have traced a total of 37 contacts of these from these three index cases. Of them, 17 were tested, 9 are positive, and 8 are negative, and pending 20 contacts. The 9 positive contacts are admitted in the COVID complex, and they are doing fine. Of those 9 confirmed contacts, we have traced 29 contacts, and 24 of them were tested. All are negative. Nonetheless, all these negative contacts are in home quarantine for 14 days. So far, a total of 185 tests completed, and 173 of them are negative. And these are PCR tests, in-country PCR tests. Now, I take this opportunity to encourage all Dominicans to continue to practice social distancing, maintain respiratory etiquette, frequent hand washing, and stay home if you have no business outside. And I thank you for listening. Good night.
And as always, our profound gratitude to Dr. Ahmed for keeping us abreast of the situation here in Dominica. And as he mentioned, we now have another confirmed case of COVID-19 on island. Our next presenter is the Principal Nursing Officer, Terelia Ravalier, and she will give an update on the quarantine facility as well as the Cuban medical team present in Dominica.
Minister of Health, Dr. McIntyre, Permanent Secretary, Mrs. Wyke, Deputy Chief Police, Dr. Ahmed, Moderator, Ms. Harry, to our listeners, pleasant good evening. I am humbled to be part of this press briefing to speak on the matter of the quarantine facilities in Dominica. Quarantine, I must say, is basically a place of isolation where persons who were exposed to the COVID-19 are placed for observation, basically in order to stop the spread. To date, I must say, that there are 6 facilities located in Portsmouth, with a total of 126 persons under quarantine. If I may just elaborate on the statistics, the facility opened on the 21st of March 2020. The total housed thus far is 177 persons. This, as I said earlier, at present we have 126. Therefore, 51 persons were discharged for continuous home quarantine. The discharge were based on nasal swabbing, which were done for 51 of these passengers with a negative results. Therefore, these persons were discharged to their homes with very, very clear instructions for continuous home quarantine. The units are manned, these 6 units are manned by capable and competent healthcare providers. The overall supervision of this unit is done by the senior public health nurse, Alexander, who is the supervisor for this region. She assists with the logistics and ensuring the smooth running of the facilities. There is also one family nurse practitioner who, I must admit, is doing a great job. Apart from her routine task at the facility, she is able to assess, treat, and follow-up of persons with other medical complaints and conditions, such as persons with toothache. We have diabetics who need review. There are also hypertensives who needs review, and this is being done by the family nurse practitioner. There is also a senior nurse midwife who too is very, very supportive. We have one pregnant client, and this nurse midwife supports and assists this client. There is also 2 nurses who come in during the day to assist and lend a hand in that sense in ensuring the smooth running of these facilities. There are also 6 community health aides who, I must say as well, they function quite skillfully within their capacity. And most important to note, we have at present at the facility a data entry or registration clerk. This person is attached to the facility in order to obtain data and to keep a head count or a count of each and every person, staff, and the facility. Note, provision is made for the staff, meaning that the staff live in the facility. Therefore, there is 24 hours of staff availability if the need arises. For example, if a client is complaining of any signs and symptoms of the COVID, there is a nurse or community health aide available to assist. Thankfully, we have not had any of these thus far. There is also 24-hour security by the police services at these facilities. Meals, I must say, are provided regularly. In the initial phase, we had this little teething issues, but I must admit, with the support from government and the assistance, we have had other permanent secretaries attached and is supporting the Ministry of Health. Therefore, there are logistical persons located at the facility to assist with the meals, supplies, and even transportation of the people living at the quarantine facilities. So I must say, thus far, there is great stability at the 6 quarantine facilities in Dominica. As it relates to the medical team from Cuba, on the 28th of March, I think it was very late in the evening, almost to the morning, 35 medical providers had a safe landing to Dominica. 25 nurses, 6 doctors, and 4 lab technicians. I must say it is gratifying to know that the augmentation of the healthcare providers are being done in Dominica. Or I must say, a heartful thank you to the government for adhering to the Ministry of Health request. And thanks too to the government of Cuba for this tremendous, well-needed human resource augmentation support. Logistics are presently ongoing for these healthcare providers, and they will soon be deployed to the necessary areas. Thank you.
And our thanks to the Principal Nursing Officer, Terelia Ravalere, for that update. Now, of course, with the new restrictions in movement around the island, it is only fitting that we have law enforcement with us this evening. And I invite the Deputy Chief of Police, Lincoln Corbett, to give a presentation.
Minister for Health, Wellness and New Health Investments, Dr. McIntyre. Permanent Secretary, Latricia White. Principal Nursing Officer, Ms. Rafael. National Epidemiologist, Dr. Amid. Media, listener and viewing public, good evening. On Saturday, March 28th, 2020, the Honorable Minister for Health, Wellness and New Health Investment, by order in the official gazette, number 16 of 2020, that is an extraordinary gazette, published, among others, a curfew. The curfew hours are from 10 p.m. on Saturday, March 28th, to 8 a.m. on Tuesday, March 31st. COVID-19 is an infectious disease which cannot be allowed to spread among the populace. The Command for Dominican Police Force has been engaged in a number of activities in support of the Ministry of Health. These include, among others, patrolling the city of Roseau, patrolling all the villages throughout Dominica, patrols at sea to prevent illegal entry, security duty at checkpoints, security duty at quarantine sites at Portsmouth, security at the COVID hospital, and surveillance at bays and beaches to prevent and arrest illegal entrance. Additionally, the Immigration Department has been identifying and arresting individuals who entered the state illegally. So far, these individuals have been quarantined at the government quarantine facility at Picard and have been dealt with according to law. I reiterate that anyone found entering the state illegally will be dealt with according to law. No one will get a free pass. So far, there are no breaches at the quarantine facilities or the COVID hospital. And I know there have been reports circulating of persons escaping or absconding from the sites. I wish to state here that these reports are untrue and malicious. No one have escaped from the facilities or from hospital. I wish to take this opportunity to express my thanks to members of the public in general for cooperating with the police during the period of the curfew and also cooperating and adhering to the other sections of the SRNO, and for also reporting breaches to the police. We have had many calls of people who are suspected to have breached the curfew order or the quarantine rules, and we have dealt with every one of those speedily. The police will do all what is necessary to prevent illegal entries into our state, and any breaches of the Environmental Health Services SRNO number 13 of 2020 will be dealt with according to law. We pledge our continued commitment to working with the Ministry of Health and other stakeholders. This dreaded disease, COVID-19, is not a joke, and as such, we're treating it with utmost utmost care. Thank you.
And thank you very much to the Deputy Chief of Police Lincoln Corbett for that update. And as we wrap up this evening's press briefing, let me once again urge our listeners and viewers to please heed the advice of the experts. The Ministry of Health often tells you what is necessary to do, and we urge you to take this seriously. We plead with those who have been asked to remain in quarantine. We ask those who have not been exercising the social distancing as advised to please do so. You are putting yourself at risk and others at risk if you do not heed these warnings. Again, thanks to everyone for tuning in this evening. We want to thank all the presenters for sparing some time, as we know that they are very busy this time, keeping our country safe, ensuring public health and safety. So again, thank you to all of them. Thank you to the Deputy Chief of Police, especially for clarifying so many of the questions and concerns that many have had over the past few days. Again, we invite you to tune in every Monday, Wednesday, Friday on DBS Radio, Kyrie FM, and the other radio stations, including Q95 and Vibes Radio, as we continue to bring you the COVID-19 health discussion, and of course, whenever we bring you the briefings. Thank you again for tuning in. Have a good evening.